Hi, I'm Dr. Austin Cope with Skin Spectrum Dermatology, board-certified dermatologist, here to talk today a little bit about Botox. Neuromodulators are a class of medications, and Botox is one of the brand names of those. There are others that are all FDA approved. Botox is the most commonly used, it's the most popular, and so these terms become synonymous. So what do we use Botox and other neuromodulators for? We use them for dynamic lines and wrinkles that appear and form on the face. Dynamic means along with movement, and we have a lot of underlying muscles in our face that create our facial expressions, and some of these create lines and wrinkles over time. The prototype of this is the glabellar complex. That's this group right here in the center of the forehead when you make this scowling forehead face. We sometimes get what we call 11 lines that develop here. I don't have Botox in my forehead right now, so I can show you and demonstrate. And so that is a great area to treat. Also, the forehead muscle develops these lines up across the forehead, and then along the lateral side of the eyes, when we squint, we develop these what we call crow's feet. And so these lines they develop as we age. Our skin gets thinner, and these lines become more prominent. And they can, over time, you can become furrows and very deep. And so Botox is a great treatment to help soften these lines, to reduce the appearance of these lines. And it does this by blocking the message from the nerve to the muscle. And as the nerve connects with the muscle at the neuromuscular junction, there's a signal that is sent from the nerve to the muscle where acetylcholine is released. Botox blocks the release of acetylcholine, and so the muscle never gets the message to contract. So this works very well, and these wrinkles that are very deep and prominent can essentially go away with a good treatment of Botox when it's well done. And this is very, very useful for these areas, and it restores a sense of confidence to patients when they have this done. It's a wonderful treatment that is universally enjoyed, and patients are universally happy with this. It has one of the highest satisfaction rates of any treatment that's done out there. It lasts about 3 to 6 months, depending on if you've ever had it before, and also depending on how much is used. But generally the average is probably about 4 months. And it's a bit of a maintenance program. You do it a few times a year, and you can maintain that great look that you like and the great confidence that comes along with those Botox injections. The patients that are the best candidates for Botox are, again, those that have developed these dynamic lines over time. And there's a question, how young is too young to have Botox done? And sometimes this can be stigmatized if someone says, oh, you're too young to have Botox done. Essentially, anyone over the age of 18 can have Botox done. And in those younger age groups, 20s and 30s, it can be a very effective treatment to help prevent the development of these deep lines and wrinkles over time. If you are interested in Botox, or if you think you might be a great candidate for it, give us a call here at Skin Spectrum Dermatology. We love to perform this treatment for you and see what you think about it.